Stress and atrial fibrillation. Can stress cause arrhythmia and other heart issues? Created by UPOlife. Over the years, doctors and researchers have identified stress as a major cause of a number of health issues. These issues are ranging from mental health issues to serious life-threatening conditions. Today we will discuss the link between chronic stress and atrial fibrillation, also called AF, as it is the most common type of arrhythmia seen in patients today. We will also discuss chronic stress as the cause of other common heart issues. There is a wide variety of so-called risk factors that are considered to contribute to the development of AF. We say a variety because many different factors can be blamed for the arrhythmias instead of one single cause. The list of potential causes that can cause heart damage and lead to arrhythmia includes physical but also emotional factors. High blood pressure, congestive heart failure, coronary artery disease, an overactive thyroid, and alcoholism are only some examples of common physical causes for AF. AF does not necessarily have to be a bad thing if we take some of the emotional factors into consideration. Many of us have experienced AF at least once in our life without even being aware of it. AF being a one-time occurrence is not a problem. There is a problem when you experience AF on a day-to-day basis or more or less common than that. When we say that most of us have had an AF, we are thinking of extreme happiness as the cause. Sometimes, extreme happiness can cause your heart to skip a bit. However, that does not make it a medical emergency. Feeling frightened can also cause your heart to skip a bit and even cause you to feel as if your heart is about to jump out of your chest. Any strong emotion can cause AF, including stress and anxiety. According to a study published in Trends in Cardiovascular Medicine, stress, anger, and depression are the three most common negative psychological causes for AF. AF occurs due to a sudden and unexpected surge of adrenaline, muscle tension, and hyperventilation, caused by stress and anxiety. A study published in the Indian Pacing and Electrophysiology Journal investigated the link between stress and AF. Researchers that were working on this study explained that stress is not only a cause for AF and arrhythmia but also AF is a cause for stress. In fact, the researchers discussed how patients who had an increased sympathetic activity due to stress are exposed to the greatest risk of developing a fatal AF. With fatal meaning that it can put an end to their lives by causing a stroke or other threatening issues. A 2001 review of 96 studies investigated the link between different psychological stressors and arrhythmia. 92% of the studies demonstrated a positive link between psychological stressors and arrhythmias, defining stress as one of the main psychological causes for AF. Over the years, stress has been linked as a direct and indirect cause of many heart issues, including arrhythmias. The presence of chronic stress and high cortisol levels can contribute to an increase in cholesterol, triglycerides, blood sugar, and blood pressure levels. Thereby, stress is indirectly contributing to heart disease, since all of the previously mentioned events are known risk factors for heart disease. Chronic stress can also increase the thickness of blood, making it more likely for blood clots to form. Such an event can increase the risk of stroke. But did you know that stress can directly damage your heart? Turns out that stress can cause a condition known as stress cardiomyopathy, also known as broken heart syndrome. This condition is caused as a result of intense physical or emotional stress, which causes severe damage to the heart muscle. Stress cardiomyopathy is a potentially life-threatening condition and requires proper treatment right away. Conclusion: AF can be caused by the use of certain medications, alcoholism, inactivity, but also stress. We seem to mention stress more and more as one of the main causes of poor physical and mental health. Learn more about how to evaluate your heart health and manage your heart condition at home by visiting UPOlife.com.